відбувається. Anyway, we will start. This session is recording now. So, hello again to everyone. I'm very glad to see all you here. And my name is Oleksii Vinogradov. I'm the liaison officer of the IAAGT Research Committee. And I want to ask other members of our committee to raise their hand and to show yourselves. So I'm not alone here. Victoria, probably you.
IAAGT?
IAAGT, not EAGT.
IAAGT, yeah.
Yeah.
I'm also.
International Association of Advancement of Gestalt Therapy. Our committee, it's a research committee of IAAGT. We organize a series of lectures that promote scientific activity in the Gestalt field. And you can watch the previous lecture, which was conducted by Margarita Spagnola-Lob on the IAGT YouTube channel. I will add a link to the chat. And today, I am pleased to present you with a lecture, Phenomenological Research Using Gestalt Therapy Principles and Methods. It will be conducted by Pablo Herrera Salinas. And a few words about Pablo. Pablo Herrera Salinas is a psychologist and Gestalt psychotherapist. He's a PhD psychotherapy research professor, clinical supervisor, and researcher at the University of Chile, where he heads the research area at the Gestalt Institute of Santiago. He has presented at scientific conferences in Chile, Argentina, Switzerland, France, Italy, and the United States. And he published on phenomenological research in Gestalt therapy, working with resistance to change and memory reconciliation in psychotherapy sessions, and on phenomenological research in Gestalt therapy. The lecture will last about an hour and a half, and before we start, I would like to note that you can support the research activities of our research committee by making a voluntary contribution to our fund. I will give the link also to the chat, and you can do it. And we have a good news. I'm a host now, so I need to set up a translation, and probably I can do it. Okay. I think I cannot do it, unfortunately. So we will translate it later. So Pablo, I give words to you.
Okay, hello everyone. Oleksii, I'm sorry for pronouncing your name like that, but you already presented me. I work as a therapist and also a teacher and researcher, but the topic of this talk is to try to go a bit deeper on a topic that blends like all of these roles. And I will share a presentation. So it's hopefully easier to follow.
Yeah, we see it.
Can you see it? Okay. So it can be seen? Yeah? Okay, great. So first of all, I just wanted to check briefly. You can maybe talk orally or in the chat, but I want to know your expectations and also your current level of knowledge about research, research on Gestalt, phenomenological research, so I can adjust and present more or less context, or go right into the meat of the presentation. Maria?
Thank you. I first would like to thank Oleksii Vinogradov and Professor Pablo from Chile for this great opportunity to listen to your lecture. And I would like to answer the question. My interest in this lecture and in this field of study and research is like that. I'm currently working on the notion of intersubjectivity. Starting from I work on that topic starting from 2017, when Oleksii Vinogradov was holding the first intensive near Kiev on Gestalt therapy. And so my interest is like that. Is intersubjectivity as both internal and external process, which includes communication, interaction, and mutual perception of people. Can we study intersubjectivity to prove that Gestalt therapy is not only the, how to say it, that CBT, I forgot it, the proven approach, what is the word? I'm sorry. The research
Evidence-based.
Okay, thank you.
Evidence-based.
It's not only evidence-based approach, but an approach which allows us through awareness to come to better results, even withholding the absence of serious scientific literature on the question. Thank you very much.
Okay, thank you. I'm looking at the answers in the chat section as well. Okay. I was reading Monique's interest. The rest, they want to, anyone wants to share something, some special interest, or just to let me know about the overall level of current knowledge that you have, so I can present more context or less context and go directly to the more specific ideas. Oh no, Nicolas, did you raise your hand? No?
Yes, Pablo. Hello, everybody. Here in Rosario, we are studying, we are researchers too and professor at the university, and we are studying now about supervision and treatment, the start of the treatment. And we are studying about grounded theory with that mark theory. So we are really interested in your point of view about this. So yeah, I am really glad to be here with you and everyone. So that is my interest.
Okay, great. Okay. Someone else wrote something in the chat section. Okay. So I'm reading the answers in the chat. Yeah, that's fine. Okay. Okay, well, if anyone wants to share something later, or if you feel that I'm going like too fast on something or going too slow, and you're getting anxious so that I can move a bit faster, you can tell me. I can adjust, no problem.
Sorry, I would like to check in myself. I'm
go ahead.
Gerardo Settani from Italy. Thank you for land this presentation, Pablo. I like the topic which is to produce research solid research to validate Gestalt therapy.
Mhm.
And I have been practicing Gestalt for over 30 years. And my level, I have a little bit difficult to describe my level of knowledge about Gestalt because I'm trying to add more continuously. I think it is not an arrival point. Gestalt is a growing process, in my opinion, also theoretical. And in particular, I'm very interested to explore what means the here and now in Gestalt, which we use in Gestalt to describe our approach also. In Italy, for example, many people names the Gestalt like the here now therapy. And I'm very fascinating to know how the physicists like Carlo Rovelli describe the time. And for me, it's connected to our point of view about Gestalt. And yes, I'm very interested to explore this topic using also other point of view from other science, like physicists, but also anthropologists and neurologists. For example, in neurology, we know the many neurological approaches using neuroimaging that describe how our brain function to perceive the time, to build the perception of the time. For example, the default mode network, network which is connected with the attention mode network, which involve other area of the brain. In other words, the time I like to explore how we build the time because it is not exactly how we know about it right now. We measure the time by clock, by calendar, but in reality, it's not the same. And Rovelli stated that in such a way, the time as we perceive it does not exist. Like
I'm
a
sorry,
Gestalt.
could you repeat the last sentence? The time as we perceive it?
Yeah, as we perceive it, the time does not exist.
Ah, okay, okay.
Yes, like
Okay.
a Gestalt. Gestalt highlighted the importance of the here and now. And there are people in Amazonia, for example, that in their language, they do not use the past and the future.
Mhm.
They used to talk only using present verbs.
Mhm.
And I like to
Okay.
explore this topic. Thank you.
Okay, thank you, Gerardo. Let me read the new comments in the chat section. Okay. Okay. Well, I think we can start to move ahead, and I will leave some time after my presentation so we can discuss some specific interests that you have and that I will maybe I didn't prepare, but we can discuss them in a few minutes. Okay, so maybe we can start with this. When we think of about research, what comes to our minds? What do we imagine? What do we feel? How do we construct the idea of research? In the answers that you gave, especially in the chat section, there were some ideas about this. And on the other hand, when we think about Gestalt therapy, what comes to our minds? How do we construct or imagine or symbolize Gestalt therapy? And after we have these two pictures, these two symbols, is there any overlap? Is there any compatibility, or do we think that there are like very separate domains? There are going different opposite directions. Because we were just discussing, I won't ask you to answer these questions explicitly. Of course, you can just interrupt me and comment on something whenever you want during the presentation, or if you don't understand something or you want to say something, it's okay for me. But in my experience, because I've been teaching about Gestalt research here in Chile and in other places for, I think, 13 years, there's been an evolution, at least in the students that I have. 10 years ago, 13 years ago, these two ideas, research and Gestalt therapy, were completely separate. Almost everyone thought of doing research, for example, doing a thesis work for a master's degree, as something that was very anxiety producing, and also that they felt like a dilemma. So do I serve like this master in my head of research, or do I serve my Gestalt master? Do I betray one or betray the other? Because the idea that most colleagues had some years ago was that research was only positivistic, quantitative research, and completely separate from Gestalt therapy. And for example, to do research on a Gestalt process would be to manualize the process and would require a betraying of all that we hold dear, all that we have been taught about Gestalt therapy. But lately, when I teach these topics, I've noticed that these ideas, these preconceptions have changed, and I think it's very good that they've changed, because research is very there are many possibilities on how to do research, and most of our resistance towards research is based on a very narrow way of thinking about research, because research can be something that is very coherent with how we perform the therapy. And we will discuss this in this presentation. There is not every kind of research, obviously. There are some ways of doing research that are useless for us. There are some ways of doing research that are problematic, that it's better to not do anything than to do that kind of research. But there are other ways that are more compatible. And there are other ways of doing research that are synergic with Gestalt therapy. So it's the answer to the last question, is there any overlap or compatibility, depends on which kind of research do we do. So I need to introduce a little bit of different types of research and then delve deeper into phenomenological research. I will check about some new comments in the chat section. Okay. Okay, so moving ahead. I like these images and I always share them because when we started doing research here in Chile, we thought about it. What's the meaning of doing research for us? I mean, the trigger for us was the fear of extinction, was our need for survival. Like we will be driven out of business if we need to do research and we don't do it. So we want to survive. But what I talked to the director of the institute here in Chile is that doing something because we need to do it for survival, even though we don't like it, is a very poor motivation. Uh, uh, and the threat of extinction, of death for our therapy was not so imminent. And so it wasn't a very good motivation to do it just because we needed to do it, like a more instrumental motivation. So what was our deeper motivation for doing research? And I think these two images represent that very well. On one hand, the child with the butterfly represents that for us, doing research is being curious about something, is recognizing that we don't know something and we want to know, we want to explore, we want to understand. And that is something that we can relate to as Gestalt therapists, because we need to have that same attitude when we get to know someone. We need to be curious. The therapy relationship won't work if we assume that we know what's really going on with the other person. If we reduce the other person to their symptoms or their DSM category or whatever, we need to be curious in front of someone else. And research is a way of satisfying partially this curiosity. So this is our first big motivation for doing research. And the second one is to be a bit defiant, to not just swallow our theoretical introjects and assume that, oh, whatever the gurus or the founding fathers or founding mothers said is the truth, and we can defy them a little bit. So we can challenge our assumptions. And research is a way of challenging our assumptions as well. And we will notice that this is true for our theoretical assumptions, and also because we have several blind spots. For example, just one example. There has been a lot of research on the therapeutic relationship and also some interesting research on the differences in the perception of the therapist and the client. And one of these differences is on the rate of the percentage of clients or patients who get worse during the therapy. Do not improve, do not stay the same, but get worse. And the percentage is around 5 to 10% of people who get worse during therapy. Not specifically Gestalt, but in general, in different kinds of therapy. But the interesting thing is that this is a blind spot for us, because when we ask the clients, some of them, 5 to 10%, say they are feeling worse. But when we ask their therapists, they don't notice that. We don't notice that. So we assume that, oh, I'm being very efficient with my clients. I'm doing great Gestalt therapy. But when someone else asks the clients, some of them are getting worse. So we need to challenge our own assumptions and to not imagine that we know everything. So that's another big motivation for doing research. Okay, so I think I touched on these topics. Why do we do this? Because of curiosity, because of critical thinking, because also of ethics. Doing research, I mean, not every kind of research, but for instance, evidence-based treatments, there is something very valid and important in that paradigm, even though we can not agree with a lot of it, but there is an important need to take care of the well-being of our clients. This is something that we need to rescue, we need to take care of. We need to consider the well-being of our clients. And also, of course, survival. Sometimes we have these external pressures that force us to do some kind of research, and that is also valid. And this need for survival in a political context, this triggered this recent Gestalt therapy research movement. Probably without this external pressure, we wouldn't be doing this seminar, for example. Okay, so then moving along, what is Gestalt therapy research? There can be several meanings. There can be several ways of understanding Gestalt therapy research. One way is just thinking about, okay, if I do research on a Gestalt therapy process, I'm doing Gestalt therapy research. I'm studying a Gestalt therapy process. So for instance, if I want to understand if Gestalt therapy is produces good outcomes, if it's efficacious for the clients, if it's effective, I mean, we are doing Gestalt therapy research just because we are focusing on a Gestalt process. So this is one way of understanding. Another more specific way of understanding what is Gestalt therapy research is to think that we are not just researching a Gestalt therapy process, a case or group of cases, but we are researching a concept or a specific mechanism of change mechanism, or something specific of Gestalt therapy. For instance, probably Margherita Spagnuolo talked about the dance steps model and the instrument that she's been developing to observe that dynamic relational process. This is another way of thinking about Gestalt therapy research. We will do research on a specific Gestalt therapy concept. In Chile, we developed another instrument to observe the process of integrating polarities in a client. This is another way of doing Gestalt research by focusing on one concept. But the interesting thing here is that if we consider the second way of understanding Gestalt therapy research, we can use the same instrument, for example, the dance steps instrument or the polarities instrument, to study a therapy that is not Gestalt. Because the concept or the instrument that we will use is specific to Gestalt, or is something that is a contribution by Gestalt therapy, but it can be used in other modalities as well. So, for example, I can analyze a psychodynamic therapy with the same dance steps instruments or the polarities instruments or some other instruments, and we can contribute something from Gestalt to the wider field of psychotherapy research. That is something different that we can do. And a third way of understanding Gestalt therapy research is is to think that the methodologies that we will use for doing research are very similar to what we do in Gestalt therapy. For example, phenomenology. And for instance, there is a specific methodology that is the microphenomenological interview that is extremely similar to something that we often do in the therapeutic session. So this is a third way of understanding Gestalt therapy research. We are doing something in the context of research that is quite similar to what we do in the context or setting of the Gestalt therapy.
Pablo,
So, yeah, go ahead.
are there any concepts of Gestalt therapy that are so exclusive to Gestalt therapy that they're not more broadly used?
Okay, very good question. I think there are concepts that are not so common to in other modalities. I haven't identified so far a concept that is completely alien to all of other modalities. So far, every important Gestalt therapy concept, there is some sort of translation equivalent in some other therapies. And more so, I think all of our important concepts could be used to understand any kind of therapy process. And this also relates to the finding that is now several decades old, that overall, every therapy is equally effective. So we cannot say that Gestalt is absolutely completely different to all the other modalities. Of course, there are differences, but the differences are not as big as the commonalities. I mean, we understand things differently, we explain things differently using different words, but every therapy does things. There are certain things that every therapy does. So even though there are some that are like quite different, but there are others who do similar things but with different names. At least as far as I've really analyzed and compared with different theories, that's my answer so far. Okay, so just a quick historical context. There have been, in Gestalt therapy research, there have been several milestones. I included Carl Rogers' initial research. Of course, it's not Gestalt, but it's been very influential in the humanistic context. But then we can see that not only in Gestalt, but in humanistic therapies, there's not so much going on for a few decades. And then Leslie Greenberg's research starts to grow bigger and bigger in the 70s. But in the beginning, as far as I've known from someone who was there at the time who told me, he was completely excluded from the Gestalt community at the beginning, because he was doing research on Gestalt therapy with Gestalt techniques, but Gestalt and research were like water and oil, or water and well, incompatible. So he went his own way, created his own therapy, emotion-focused therapy, and then after several decades, he got invited as a keynote speaker to our Gestalt conferences. But then again, inside the Gestalt community, there was almost nothing in about research. I mean, not completely nothing, but almost nothing. And then Phil Brownell's book in almost 20 years ago had a section on Gestalt. Then some 15 years ago, there was a big problem in at least in my knowledge in Germany, and the politics, the requirements for being included in the health insurance system changed and put a lot of pressure for people who are not psychodynamic or CBT. And so they started to work on doing research to change that and be included as a like a valid therapy for people to go to and for ask the government for refunds for their expenses and stuff like that. So for instance, we knew in Chile about this need for research in 2012 because the Austrian colleague Otto Glenser came to Chile and told us. We didn't know, we didn't care about research, not at all, frankly. But after that, we started including that in the training. I started teaching about that. We developed, we changed our way of finishing the Gestalt therapy training to include one intensive case study, empirical case study. Before, no one did that. We didn't do any kind of empirical research. And we changed our whole concept of how to finish the therapy training to contribute to research. And we published some papers regarding that. Then, well, we started with the Gestalt therapy research conferences that probably many of you know and maybe have attended. And then we started to create some instruments and develop some support groups for research. And now there are several international research projects. But the limitation is that we are working with practitioner networks because most of us are not in universities. I mean, some of us are, but we don't have in general in the Gestalt community much access to funding or to resources that other modalities have because they work a lot in universities, they get access to government funds and stuff like that. So there is a movement towards doing research, but we don't have a lot of resources. So we need to adapt to that reality. Mm-hmm. Okay, so let me check again because I think there have been some comments in the chat section to see if there are questions. Okay. We'll stop just for a few seconds to check what you've written in the chat section. Okay. Okay, so let's go on. This section, I don't want to go so deep because it's more general about research, but I need to contextualize a bit on phenomenological methods. Okay, so when we talk about phenomenological methods, this is a specific kind of methodology for researching some research problem. So what's the idea? That, okay, we can say, I like phenomenological research. I want to do research with this kind of methodology, but this doesn't fit with every research question. We don't want to start with the methodology when we don't know what are we researching. So first, we need to think of the question that we want to explore, and then we need to check which methodology fits. Mm-hmm. So first we think of a topic, then we think of a problem, a research gap, a research question and objectives, and then we can think, okay, so which methodology fits. This is something that is applicable to every kind of method, but I don't want us to think, okay, I want to do phenomenology, and I want to use it with any kind of question, because it doesn't fit with any kind of question. Okay, so now, what is this approach? I want to contextualize with different ways of understanding a phenomenon. And this is, I don't know if you know Ken Wilber or integral theory. They have a very useful framework for understanding ways of looking at a phenomenon. And they have this 4 quadrants model in which any phenomenon can be researched or approached in 4 different ways, 4 quadrants. We can look at it from an individual point of view or collective point of view. This is one axis. And on the other hand, we can look at the interior aspect, the experience, individual experience or collective experience, more cultural, we could say. And also we can look at it, at the same phenomenon, from an exterior point of view. Like looking at the behavior from an outside perspective, looking at the brain from an outside perspective, like individual exterior or collective exterior. Look at the material conditions in which someone experiences something, like a Marxist point of view or a systemic point of view, an old systemic point of view. So phenomenological research is basically here. Or it could be here as well, more anthropological, we could say. And so the same phenomenon can be observed in different ways, with different questions, with different methods. So this is an important idea to locate when phenomenology, I'm sorry, is useful and complements other ways of understanding a situation. So we can use different methods to look at something from different perspectives. It's not that one method is clearly superior to another, is that one method focuses on a different perspective. So, for example,
Sorry.
yeah, go ahead.
Sorry, Pablo. I have the microphone muted. I would like to share with you in this moment. I find a little bit difficult to separate in these 4 perspectives the research. In this moment, I don't know. I need more information.
Yeah, go ahead.
Possibly, but it's very difficult for me to think about the subjective process, for example, and intersubjective process for the other way. I think both is involved to describe what happens in the therapeutic process. Thank you.
Okay, wait a second, Maria, maybe you want to share something about this question, but
yes,
I think...
I would...
Okay.
No, sure. Is it okay?
Go ahead.
I would like
I
to
can
answer
comment later.
Professor Gerardo Setani's question. So, for instance, if we compare subjective and intersubjective, then so there are 2 dimensions. First vertical and one horizontal. And both subjective and intersubjective are a continuum from individual to collective. Subjective, individual, collective, intersubjective. And at the same time, they are interior, not exterior. Both of them are more interior than exterior. And I would also like to add here that I have a questionnaire created in Ukrainian. It's created in Ukrainian on Ukrainian sample. It's called somehow like questionnaire of intersubjectivity questionnaire. So it's 16 item questions using a 5 Likert scale, if I'm not, and the points are from 60 to 80, and it has good psychometric qualities on a Ukrainian sample. Thank you.
Okay, so what this slide intends to do is to argue that these perspectives are complementary. And so we need to understand which perspective is useful for understanding what. So, for example, we want to something quite simple. We want to observe if a therapy is doing well or not. Okay, this is a broad question. We need to make it more specific. We can observe, for example, the feeling of connectedness, of synchrony between patient and therapist, because that is an important variable in understanding if a therapy is going well or not. Are they synchronizing? Are they feeling empathy and connection and trust? This is an intersubjective perspective. We also want to understand, for example, the way that the therapist deals with the personal triggers of this specific client. For example, a client who has faced some very traumatic experiences with abuse. This kind of content sometimes is triggering for us therapists, and it's sometimes difficult to deal with those stories and contents. And so we ask the therapist to understand their perspective, their experiences, their feelings. This is a subjective perspective on the therapist. We also want to understand how does the trust process develops in the initial phase of the therapy, because we assume that trusting the relationship, trusting the therapist, and being able to open up is an important aspect, but we want to understand how is that experience and develops for the client. This is also a subjective perspective in which we focus on the client. We also, for example, want to observe this how this trust develops in looking at which parts of the brain flare up or stay more silent, because we think that there are some things that can be observed looking at the brain. For instance, if there is the attachment network that is being activated, or the threat network being activated. This is an objective perspective in which we observe maybe the same process, but from an outside perspective. So this is just an example, but the same phenomenon, we can look at it from different perspectives, and it's not like one is inherently better than the other. It's that there are different ways of doing it. And if we want to understand the experience of someone, of how does the client develops this trust and begins to open up, if that is our specific research question, this is the correct perspective. Looking at the brain, it's not very useful for that. Looking at the intersubjective processes, also not so good. Because the experience of a person in which they are opening up, this is an subjective experience, of course, in a relationship, but every experience is in a field. I will return to that in a couple of minutes. Okay, so I don't know if this answers a little bit the question or not. Yeah. Okay. Okay. I'm a bit worried about reading the chat and interrupting the talk like all the time. So if you have a question, you can write it down in the chat section, but please raise your hand or just say I have a question so I can read it. And if not, I will read all the comments in a while. Okay? In a few minutes. Okay, so this is another way of understanding how to do research, but specifically for psychotherapy research. Okay, so when besides these four perspectives that can be applied to any kind of phenomenon, any kind of research, any topic, we can also differentiate something that is very specific for psychotherapy research. We can focus on the outcome of the process, the outcome of the therapy, but also, this is not like a dichotomous decision. We can do both. We can also focus on the process of change, on what goes on during the therapy. And we can make relationships between outcome and process as well. For example, if we ask, is the therapy effective? Do clients relapse? For whom it is effective? Those are all outcome questions. They are perfectly valid, just that they are outcome questions. That can be researched with quantitative, qualitative methods, a mix. But we can also focus on the process of change and the change mechanism. The change mechanism means what do we think produces the change and how does that happen? And the process just means that it's before the outcome, during the therapy sessions. Maria?
Yes, thank you very much. I would like to ask a question here. Are you acquainted with the legacy of Lev Vygotsky, Grigory Kostyuk, and Sergei Maximenko? Ukrainian and a bit Russian, Belarus, Russian, Ukrainian. Lev Vygotsky, researcher. The first half of the beginning of the 20th century. And then Grigory Kostyuk, who founded the institute in Kiev, and then Maximenko, who died last year. And well, are you in general acquainted with the works of the mentioned researchers? Thank you very much.
Just Vygotsky and some of his basic ideas, not in depth. Okay, so also we can think of this difference. Are we looking at the process? Are we looking at the outcome? Are we looking at both? And from which perspective? From a more like internal perspective, external, individual, relational, several at the same time? Ideally, we would like to focus on everything, but it's impossible. And one of the barriers that I've noticed in doing research is that we know that every phenomenon is complex and there are many variables, and we want to tackle all of them. Because reality is complex, and we think that we don't want to reduce something to just one little variable. And of course, it makes sense that we don't want to reduce something, but because it's so hard to do research, often when we try to do something more complex that we think is more valid, it ends up being so difficult to do that we don't do anything. So one of the challenges of doing research is to go through the grieving process of noticing how we can do only so little. And we go ahead with very small baby steps. And we think that we are not doing like anything meaningful, but it's the best that we can do. So this is like more an internal process, like the countertransference of the researcher that needs to be worked with. The facing that we can only focus on one or two small aspects of a complex whole. Okay, so getting to the core of the talk. What could be Gestalt phenomenological research? And I will talk about some specific ways of doing it and some examples as well. So my idea of how to answer this question is that Gestalt phenomenological research means exploring personal experience in a situation. So it's not intrapsychic, it's experience in a situation. And this is key because, for the methodology, for the interview technique as well.
I'm sorry, can you share
yeah.
more these differences? You sense it's a key differences from personal experience and intrapsychic. What's the differences in interview and methods?
Okay. I can go a bit deeper on this in a few minutes, but I can answer. For example, because we think that experience and symptoms and feelings and everything psychological arises in a specific situation, in a specific field, this is our theory, right? And in the interview technique, we need to consider this as well. For example, if we try to understand an experience, something that I've done in all my interviews and I've taught my students is to ask the person being interviewed to remember a specific situation in which the phenomenon happened and to go back and evoke that situation. So tell me the last time this happened. Can you go back to that situation? What's going on around you? What are you seeing? What's happening? What do you do? So put the person in the situation in which something happens. This is a concrete way of operationalizing this. We are looking at the experience in a situation. Because if not, we can go to the abstractions that are that do not relate to what the person is experiencing in real life. We don't ask them, for example, what do you think about this topic? How do you explain this? We ask them, for example, okay, I will talk about my PhD work was with trying to understand people who wanted to change their health habits because of a medical condition. and trying to understand why many of them did not change their habits. So, for instance, they had to start doing exercise, they had to change their diet, they had to take some pills, stuff like that. We didn't ask them, why do you think you don't take your medication, or how do you feel like in general about the treatment or about your illness? I mean, some of those questions could be a little bit useful, but what we mostly did was, okay, tell me the last time that you wanted to do part of the treatment, but you didn't do it. And I will give an example. So there was this architect who was very well aware of why he needed to change his habits. He needed to do more exercise. He liked doing exercise. He had the time. He was very well aware of the dangers of not taking care of his body. And all of this was in more abstract terms, and he talked about it. But I wanted to understand the specific situations in which the problem happened, in which he, knowing that he needed to do exercise, he didn't do it. So I tried to put him in the specific situation in which this happened. So I asked, okay, so tell me the last time that you had planned to go to the gym, but you didn't. And he said, okay, this is something that happens all the time because I could go to the gym after work, and I should do it. I don't know why I don't do it. I must be lazy, maybe. And so this is abstractions, rationalizations. He's not going back to the situation. And I asked, okay, tell me the last time it happened. And he said, okay, a couple of days ago, I could have gone to the gym, but I stayed at work. And so I asked, okay, go back to a couple of days ago. Tell me what's going on. What are you seeing? What's happening just before you stayed at work instead of going to the gym as your treatment needs you to do. Okay, so he started remembering what happened, and I'm talking about it, and he had finished his work, his personal work, and he could have gone home. It was time for him to go home and go to the gym and be a good patient. But what happened was that some younger colleagues in another work team in his company, he was an architect, a senior architect, these younger colleagues asked him for help. They needed his guidance. And so he went there and he helped them and stayed at work helping them. And so then I asked him to imagine the same situation in which he says, I'm sorry, I cannot go. I need to go to the gym, or I need to go home. And check how does that feel. And what he noticed very easily was that if he didn't go immediately help his younger colleagues, he felt like he was getting old, he was becoming useless, and he felt very valued by his colleagues if he went to help them. So in this specific situation, he faced a personal dilemma. He could either take care of his body and go to the gym, or he could invest in his personal value as a professional, in feeling connected and appreciated by his colleagues. And so in that specific situation, his experience was that there was a conflict. There was a conflict of important values for him. And if he had gone to the gym, he was risking losing this appreciation, this professional value and feeling obsolete as an architect because he helped the others, he wasn't needed anymore. So the answer to why didn't he go to the gym and take care of his body better, for me the answer was that dilemma for him. I don't know if that illustrates a little bit what I mean by exploring personal experience in a specific situation or field. Okay, we can go back to that in a few minutes again and check with other examples. So this is the third idea here is the embodied empathy criteria. This is not something that is intrinsic for phenomenological research, but I think this is a very useful idea for our way of doing this kind of research, is trying to put myself in the person's shoes as the person experiences the situation and try to understand, okay, would I behave the same way? Would I react the same way? To use our empathy as a way of like a validity criteria in the interviews and in the data analysis as well, because the best value for the phenomenological research is to understand the implicit experience. If we do not really care about the implicit experience, we can use other qualitative methods or even quantitative methods. But phenomenological research is the best way to trying to understand the implicit experience. And I think this is a very good criteria to check, are we understanding? So finally, our way of doing Gestalt phenomenological research, at least this way that I'm suggesting, is very much alike our process of understanding clients' experience in therapy. The example I gave with this person that I interviewed for my thesis is something that I could have done with a client in therapy. Because in both settings, in both contexts, it's crucial to understand the other person's experience for different ends. But the process of understanding, empathically understanding the other person's experience is key in both contexts. In a qualitative research, in this kind of qualitative research, and also in psychotherapy. Okay, so going a bit deeper, so this kind of phenomenological research uses some specific skills and methods, like interview methods, that come naturally to us. We use them every day in our clinical practice. And also focuses on exploring a person's lived experience in the world. This is, again, something that there's almost complete overlap between what we do in this kind of research and what we do in clinical practice. And one example, one very concrete example, is the microphenomenological interview. This is an interview method that doesn't come from Gestalt therapy, but when I heard about it and I understood the examples, I thought this is the same thing that I was taught to do in Gestalt. Like this instruction that this was a basic method for understanding in my training, in my Gestalt training 20-something years ago. Tell me in the first person, in the present tense. Go back to the situation and to your experience in that situation. This is basically the instruction for the microphenomenological interview. I will, in 2 minutes, go there. Also, but This is something that is completely uncommon, but I think fits very well, because there is this assumption that if we want to compare groups in a research project, we need to use quantitative methods, maybe even experimental methods, like the intervention group on the placebo group, something like that. But we can use this kind of interview, this kind of methodology, also to compare groups. For example, we can focus on the process of noticing and sharing difficulties in the therapy process. And we can try to understand what goes on in that process when a client decides to share something that they are struggling with, maybe a rupture in the relationship, something they don't like, or not share it and just drop out, because many people do that. Many people notice that they don't feel comfortable with something, with a technique or with something in the therapy, but they never even mention it, and they just drop out and give an excuse, or they don't say anything. So this is a very important psychotherapy question. What's going on? And we could use phenomenological methods to explore that. But we can also use that same methodology to compare groups. We can do group comparison using qualitative phenomenological methods. We can do this kind of interview, in-depth interview, and then later, this is not very common, at least in my experience in qualitative methods, we can differentiate the sample in two subgroups. People who finally dropped out without sharing their concerns, and people who elected to talk to their therapist about what was going on. And so we can use this kind of methodology for a lot of things that are very useful and practical. And often for example, a typical way of doing this with qualitative methods would be to not differentiate these two groups and just put the whole sample into the same analysis and try to create a common model to explain everyone. And I think that's not the best way of using qualitative methods every time. But okay, so I'm reaching the end of what I had prepared. I want to mention this microphenomenological interview, then go a bit deeper into one example. I already mentioned it a little bit, and then to open up the discussion for more questions, examples, discussion as well. Okay, so the microphenomenological interview, this is something that is not intrinsic to Gestalt. It's not even from the context of Gestalt therapy, but it's very similar to what we do in Gestalt, and it fits quite well with our common practice. Okay, so the aim of this type of interview is to access and describe the moment-by-moment structure of a lived experience, focusing on how this experience unfolds. So the idea is to evoke a specific situation for the person to inhabit, just as I mentioned before, to evoke a specific situation, to try to get the person to remember and live again that specific situations. We also, in this kind of interview, pay attention to raw sensory, emotional, and cognitive micro gestures, some of them implicit. For example, the interviewee could be saying, okay, so then I don't know, For example, how's the experience of doing research for an academic paper? Something very simple. So I was reading and I was trying to highlight the important parts, and the person is like with this tense face, and I could comment on that. Notice what's going on in your face. What are you feeling right now? And those kind of observations can be included in the interview. Because we're also identifying implicit and non-verbal mechanisms. So in this short example, I think you can see that this kind of interview is extremely similar to what we would do in a therapy session if we want to understand an experience. Try to get the person to transform the problem from something that happens in the outside, in the past, to the here and now. Try to get the problem to the here and now, and to observe everything that is going on. Not only the explicit, more rational part of the experience, but also the more implicit, the non-verbal. Okay, so yeah. In the end, I wanted to share the example of my PhD thesis. I already gave a part of this example. It was about non-adherence to medical treatment for people who wanted to make some changes because of health reasons. They needed to change their diet, their exercise habits. They needed to take medication, stuff like that. So I gave an example of an interview. And now I wanted to add, what were the research questions for that study? Two key research questions. I will add some more. But two key research questions were, in which subjective world does not adhering make sense? Because they attributed not adhering to being lazy, being irrational or stupid, and we work from the assumption that somehow it makes sense implicitly to do that, and to try to understand how it made sense. And another question was, what's the implicit intentionality of not adhering? What are the values that are being protected by not adhering? For example, in this case that I shared, a few minutes ago, it was self-esteem, feeling valued by others and valued by himself. That was the value that drove non-adherence. It wasn't about not noticing the dangers of not taking care of his body. It wasn't like that. He was very well aware of the dangers. But there was this situation in which he had this conflict. And another question could be, and that we explored, and I published a paper on this, was how do they deal with this ambivalence when it arises? When they have this conflict between looking after their health on one hand, and, for example, protecting their sense of self-esteem or autonomy. Do they ignore one of these needs, one of these parts or polarities? Maybe we could think of them like that. Do they try to integrate them, to have some dialogue between them, recognizing them? And one of the papers argued about a connection between how do they deal with this inner conflict, the conflict between parts, and the outcome measured in their adherence to the treatment. And the argument was that when they try to get their good side, the side that wanted to get healthy and adhere to the treatment, to win and to crush the non-adherent side, sometimes the real adherence to medical treatment could be good, but it was short-lived. Only for a short time could they sustain, like forcing themselves to do it. But most of the time it wasn't good. It was very irregular. Like, for instance, one woman told me that during the day she was very strict with her diet. Then she collapsed at night and drank 1 bottle of Coca-Cola every night. Very irregular. Like dominance from one side and then dominance from the other side, and with no integration. And on the other hand, when they try to acknowledge and validate their own conflicting needs, they could reach a much more sustainable adherence and habit change. It could be like almost perfect for their needs or good enough, but it was more sustainable. So this was a way of understanding a mechanism of change, like how do they deal with this ambivalence? With an outcome measure. So do they adhere finally? Do they improve their health results? This is one example. Okay, I'm not aware of the time. Oh, it's quite late. I'm sorry. So this is what I wanted to present. There are several things that you've written in the chat section that I haven't read. I don't know if we need to finish now, or the part where I was talking was until now, and we can have some time for questions or comments. I have some
Yeah, thank you.
some time. Mhm.
Thank you very much, Pablo, for interesting lecture. And my proposition is to have some limited number of questions, so we can discuss questions and we will have some particular time for this webinar. What do you think?
Yes, for me it's okay to have some questions. Yeah, if you want to share some like speaking orally, I will read also the questions that you wrote in the chat section. Do you have some any specific comment or question? I can also I'm starting to read the comments in that I haven't read. Maria?
Yes, first I would like to thank you, Pablo and Oleksii and Julia, for support in this project and for organizing this great event in field of Gestalt studies. And I have a question, dear Professor Pablo. What do you think? What are other perspectives of Gestalt research nowadays? Thank you.
What do you mean? What are the perspectives?
So you did a phenomenological approach research in your PhD, and you develop it on like how to make it even better for research in Gestalt therapy. And there are also other approaches, for instance, Kristen Stevens and her case study approach, and Margarita Stempaniela-Loeb with her approach, and Oleksii Vinogradov with his research on studying peculiarities of Gestalt education throughout the world, and other studies. And I would ask you, how do you see it? What is the next step?
Okay, great question. I think I strongly suggest to look at the different collective projects that are going on right now. There are several. And if you want to do some research, join a project or to do it in a group. If you haven't done research previously and so don't have a lot of resources in terms of maybe technical knowledge or time or money or whatever, it's more important to join a group. If you have some experience or resources, I would also suggest to join a group, but maybe you can be a bit more independent. You can maybe create a group even. But if you want to contribute and don't know how, join a group, because there are several projects going on and doing research is hard, and it's much easier, sustainable, and also fun to do it in a group. So I would try to uh, um, channel all this motivation and energy into a limited number of projects, not infinite number, because energy can dilute and we can try to do too much and not do anything very well. So I would try to channel our energy into different options, but not infinite options, or not that everyone creates a new research project, because it's way too hard. Glenn?
Hello, hi Pablo. Thank you
Hi.
for today. How would we go about finding those research groups?
Okay, this is another important question. I think there have been some initiatives to share in a public place the different groups that are active. I don't know if there is like a global place where you can find it. There are some websites for Gestalt psychotherapy research, but I don't know if they're super updated. So probably you would need to ask the person who you know who could be the most knowledgeable. For example, if you are part of an organization, if it's a big organization, they have a research committee and they should know of several of these projects. So if you're part of an organization, ask the research committee of that organization. If not, then probably you need to at least write to one of these organizations. I don't know, the letters IAAGT, for example, or some of them. There are research groups in all of the big Gestalt organizations, and they are quite aware of several of these projects. So go there, I would say.
I want to add that Julia wrote that you can contact to Christine Stevens, and she leading a big project of case study project. So it's very interesting project, and you can just write to her.
Yes,
And
yes.
she can, and there's already groups that have been established. So you can attach yourself to an established group with a mentor who will support you along the way.
Yeah, also, if some of you works at the university, that can also be a hub for other colleagues, because at universities we need to present projects, we can create research projects, but many times we need help, and so other people can help, and we could create something, but in group with someone who already has something going on or has the time and means and probably the need to create something. So if one of you is a professor at a university, we are asked to do this. So if we do something and there's no one has the need to do it, it will dilute. There has to be a need. We managed to publish a lot of case studies because the researchers needed their degree, their final degree. So there was that pressure. If no one has any kind of pressure or need, it won't happen. Um, um, In the meantime, that you think if you have other comments or question, I will read the things that you wrote in the chat section. So I remember something that you mentioned at the beginning that I didn't talk about so much, the idea of evidence-based. This is a big issue that you mentioned several times, and it's very important for us. What does it mean, evidence-based? Evidence-based doesn't mean to have a randomized clinical trial. It's not the only way of having like evidence. You can have case studies. You can have this group of case studies based on a network of individual practitioners who get together, like in the Christine Stevens project, or Margherita Spagnolo has also a project like that. There is this the methodology that we used several years ago, that it was the single case time series study. Also a different way of doing it. But for presenting evidence that Gestalt therapy works, which is a specific kind of question. This is an outcome question.
Yes.
Not process. This is not why it works. This is, does it work or not? This is a very narrow way of understanding research, but it's important. We need that kind of research as well. It's not the phenomenological research is could be done, but it's not the most efficient way of tackling that question, of addressing that question. The most efficient way is to ask the client. In that way, it's sort of phenomenological. We ask the client, but we ask them with some, we use some standardized measures. So we need to do some quantitative methods. We could also include some qualitative methods. What is an important topic here is that many times we observe, we check, does the therapy work using methods, for instance, questionnaires that only focus on a little bit of what we try to do in therapy. And that is a problem. And I think we need to address that problem. For example, we say that what do we try to do with a good Gestalt therapy? We try to make help the person be more aware of about their feelings, needs, be more in touch with their body, with their all of their sensations, and maybe an outcome measure could be: do you feel more alive, with more energy? And if they do, we think it was a very successful therapy. And we can argue that it's extremely important to reach that outcome. But how do we measure that? If we only use an instrument that checks if the person has low or high anxiety, that instrument is so incoherent with what we are trying to do that it can show that a therapy was bad when we and the client think it was good, because the person is more alive and feels all of their emotions, including maybe fear. And that the translation of that for the outcome instrument is they have more intense symptoms. So I think that is a key issue. And how do we deal with that? We include different instruments for measuring outcome. We probably need to include some that are standard, but we don't say that outcome means less of a specific symptom, because we try to do much more than that. And we need to have a specific way of capturing that. And there are instruments. There are instruments, for example, for general well-being, for growth. There are instruments that are much more aligned with what we try to do. So the selection of the outcome instruments are key. That's what I would say. We select instruments that can notice what we try to do in the therapy and do not reduce what we try to do and do not mistake what we try to do. Oleksii?
Yeah, thank you again for interesting lecture, and I think we need to finish right now. So I want to repeat that this lecture will be on YouTube channel, IAGT YouTube channel. And thank you, participants, to be here, to be so active and to ask interesting, important questions. So I hope see you next time in the next lecture.
Yeah, thank you.
Bye-bye.
Bye-bye.